You are watching McLaren Port Huron Today's Health, and today I'm speaking with fellowship-trained orthopedic spine surgeon Ryan Goodmanson about conditions that affect the lower back. Dr. Goodmanson, thanks so much for coming today.
No, thanks for having me. I appreciate it.
So we're going to start with the lower back. So can we start with the anatomy? I believe you have a model that we can show the audience.
Sure, we can bring out my handy-dandy model here. So low back pain is very, very common. You know that everyone pretty much has low back pain, but why does that happen? And that starts with the anatomy of the spine, basically. The spine is a column, and it's built up of bones and soft tissues. And what those bones do, the vertebral bodies, sit on top of each other, and the vertebral discs sit in between. The vertebral discs are basically shock absorbers of your spine, and they're built up of cartilage. The spine then, as a column, there is 5 lumbar vertebral segments which attach to your sacrum, which in turn attach to your pelvis. This allows for a force distribution kind of along your lumbar spine. What happens then is you have nerves that exit at each level, and we hear about different nerves exiting at different levels, and they're named for each of the levels that they are. On the back of the spine, there are joints, and these are called facet joints, and these are somewhat the check rein of the spine, if you will, and prevent the spine from rotating too far, sliding forward too far, and essentially, like I said, are the check reins of the spine and allow you to have motion in essentially 6 different degrees: flexion, extension, rotation, as well as side bending to each side.
So what are the common conditions that, people that have back pain, what are you looking for?
Sure. Back pain is what we like to call multifactorial, where it's very hard sometimes to pinpoint the exact place where back pain starts. However, because there are so many different moving parts in the spine, there can be so many different areas where pain can originate from. Like I was saying, the joints on the back of the spine are in fact joints, just like a knee or a hip. They're much smaller, but they do have a capsule and they have fluid within them. These joints can wear down over time, just like any joint in the body can. This can be a pain generator for patients. The other thing that can happen is you can have degeneration or wear down of the shock absorbers within your spine or the intervertebral discs. Much like shocks on a car wear out over time, these discs can also wear out over time. Other pain generators, and probably the most common thing, is just the muscles of the back. If you think about it, the bones of the spine are very deep within your body. There are layers and layers of muscles that sit over the spine, which can cause intense pain for people when they strain them, overwork them, or just injure them in any way. These are also pain generators. Significant pain can come from compression on nerves, can come from, again, injury, which can cause compression on nerves, which kind of ties into some of the other things that we're going to talk about as far as stenosis, nerve compression, herniated discs, and so forth.
So let's start with the lumbar spinal stenosis.
Sure.
Explain what that is.
Sure. Stenosis is a term that simply means narrowing of a conduit. Similar to getting stenosis within your coronary arteries, you can have stenosis within the conduits where the nerves exit. The neural foramen, or the nerve canal, which is formed by the bones of the spine, can become narrowed over time. This again is multifactorial. There's several different reasons for this to happen. One of the reasons is a herniated disc. If you look here on the spine model, you can see simulating a herniated disc. And the easiest way to think about this is to think about a jelly donut. If you were to step on a jelly donut and squeeze the jelly out from the inside, that jelly has to go somewhere. In the spine, if the jelly shoots out towards the back and towards the nerves, this puts compression on the nerves, and this hurts patients and causes symptoms which are essentially what we call radicular type symptoms. That's pain in the low back, pain that travels in a very specific distribution down the leg, or pain that travels into the buttock region. That pain can progress, and people can be very uncomfortable because of this. Another reason for stenosis is, again, degeneration. Time gets us all, basically. Over time, your joints can wear out, but what they do is they hypertrophy. Hypertrophic facet joints is something that causes not only central stenosis or stenosis around the central canal of the spine, but also foraminal stenosis. The foramen are where the nerves exit at each level. And if you think about it, where the facet joints are, they sit right over where the nerves are exiting in the foramen. The facet joints, if they overgrow then with time and with arthritis, they will end up putting pressure on those nerves, and that can cause pain as well. That can also cause central stenosis because of how big these facet joints are. The last thing would be simply degeneration of the disc or wearing out of the shocks, like we talked about before. As those shocks wear out and they get smaller and smaller, you decrease the amount of space in between each of the vertebral bodies, which in turn decreases the space for those nerves exiting.
So I keep hearing pain. Is that the most common symptom that people present with, or are there other specific symptoms?
It's a very common symptom, and pain is difficult to determine because it can come from so many different areas in the spine. The things that we worry about more so are pain that is out of proportion to what may have happened to the patient. We worry about pain that travels along the distribution of a nerve, like we talked about, radicular pain. Radicular pain is such that when a nerve gets compressed, say the L5 nerve root gets compressed, it follows a very specific pattern down the leg, which is called a dermatome. That's a specific pattern that nerve serves. That usually travels down the leg, past the knee, and into the foot. Those are the types of pains that we worry about a little bit more. The other thing that it can cause is over time, it can cause weakness. This is something that we like to jump on a little bit quicker than others, because once a patient starts to get weak in their nerves, we know that those nerves are unhappy, and we need to do something about it.
Dr. Goodmanson, thanks so much for speaking with us today. This is great information for our audience.
Yes.
So thank you for watching McLaren Port Huron Today's Health. If you would like to make an appointment with Dr. Goodmanson at McLaren Port Huron Advanced Orthopedics, you can call the number on your screen or request an appointment through the website. If you would like to watch additional videos, just visit our website at www.mclaren.org/PHTH. This is Kelly DiNardo for McLaren Port Huron Today's Health. Thank you for watching.